Hello and welcome everyone to the StoryAidEU Module 3, which is covering Introduction to Interprofessional Education. Today we will cover 3 learning objectives, IPE as a broad concept, the theory of IPE, and some examples of IPE in practice in both multi- and interprofessional settings. We will go through the following concepts during this presentation: the history and theory of IPE, IPE as a broad concept, some of the fundamentals that make up IPE, collaborative practice and how that works with interprofessional education, and a number of model cases for IPE. Now, we will look first at the history of interprofessional education. It originated somewhere between the 1960s and 70s, mostly within the US and the UK, but actually there are some other examples of working together in different cultures across the world. The WHO first conceived an interprofessional education expert group, and since then there has been more bodies of research on the topic. For example, in the 1980s, reports on continuous education for physicians and learning together to work together for health both showed early efforts of IPE, which focused on teamwork and collaboration to meet patient needs, as well as to resolve tensions between co-workers. So next we will look at the constructs of IPE. In an interprofessional environment, students are provided with structured opportunities that enable them to interact with other healthcare professionals. These students then acquire knowledge, skills, and professional attributes as part of their undergraduate learning experiences. Following that graduation, the expectation is that the students can translate their learned skills and experience into collaborative practice, which is working more cohesively as a team. As we all know, working in practice can be a complex and intense environment that requires a high level of interpersonal skills to be able to work in an adaptable, flexible, and collaborative team. That requires everyone to appreciate the roles of different healthcare professionals. Here is the concept that we came up with for interprofessional education within our project and the research we conducted within the first years of our project. Interprofessional education is defined as the development of healthcare students to learn with, from, and about each other, to teach them to work collaboratively in practice, resulting in improved patient care. And I think if you listen to the other modules, particularly the other introductory modules, you will notice there are some very similarities and synergies between the 3 concepts on interprofessional education, humanism, and storytelling. What we think of IPE is really an all-encompassing, and there are a wide range of professionals that can participate in interprofessional education and collaborative practice. Essentially, any medical or allied health professional that engages in patient assessment, care, or management may be included in IPE. And we must also include, particularly when it comes to collaborative practice, the patient's loved ones and family and friends, and also other people can be included as well, such as healthcare management, cleaning staff, anyone who works within the environment of healing. Now we will dive into the core concepts of IPE. We have 4 defining attributes that are identified in the literature. Here you will see active involvement, which includes interactions by 2 or more members of a healthcare team who participate in either patient assessment and/or management. Experimental learning and socialization processes. IPE involves a process where participants learn with, from, and about one another across disciplines via the experience itself. It's about the doing. Anagogical experiences. This means that IPE involves processes whereby knowledge and values are shared between participants in a non-hierarchical manner. The real core concept here is that all members of the team are equal and that the knowledge and values are shared amongst that team. Ultimately, that the patient should be at the center of everything we do. Finally, we have collaborative, patient-centered care, striving for optimal healthcare outcomes that are not driven by content or subject matter. Now we will discuss IPE and collaborative practice. This is an extremely important topic due to, one, the complexity of healthcare with patients having multiple pathologies, and two, the demand for collaborative work between healthcare professionals from different backgrounds. We must therefore have healthcare professionals developed and knowledgeable and with the required skills to work together effectively and that can have a positive impact together for the patient. The WHO framework on IPE highlights some extremely important points, such as the importance of adapting team-based collaborative models in all areas of healthcare to enhance delivery of services. It also emphasizes multidisciplinary communication to deliver the highest quality of care and collaborative problem solving, which involves interacting, negotiating, and jointly working with healthcare professionals of all backgrounds to address patient needs. All in all, the benefits of collaborative practice include strengthening healthcare systems, improving patient care, both quality and safety, reducing costs of care, shortening duration of stay, while also improving healthcare outcomes. You will notice from this model case, and I will encourage you to pause it and have a read through yourself, that you'll see all the elements and all the core attributes defined within this case. Active involvement, non-hierarchical and decentered experiences, an experiential learning and socialization process, collaborative patient-centered care, knowledge and value sharing processes, and lastly, a process where participants learn with, from, and about one another. All of this is encapsulated in this model case. However, the next slide, as you can see here, shows a contrary case, which is really the antithesis of the model case. Again, I will encourage you to pause and read through this. And I'm sure many of you will have seen from your experiences, either as a student practitioner or for those of you who are currently working in the healthcare setting, you will notice the antithesis and the nature of this contrary case and how we should strive for the model case. Globally, many countries are incorporating IPE in practice, and this can provide inspiration and ideas for training globally. We've provided a number of different examples here for reference, and again, I would encourage you just to take a look and to pause and to take further stock of some of these examples if you so wish. All of them are really interesting, extremely relevant, and will provide extra contextual basis for this module. But now to conclude this module on IPE, we would like to highlight just some of the defining things that we believe you should take away from this module. There is an international consensus that healthcare professionals learning together and having a deep understanding of each other leads to better healthcare practices and improved patient outcomes. The complex needs of patients and multifaceted treatment plans make interprofessional collaboration of vital importance. And lastly, and I really can't stress this enough, that interprofessional collaboration requires healthcare professionals, that's you, the person listening to this, to be open to collaborating with colleagues from other disciplines, learning from others through common experiences, sharing knowledge and perspectives, and prioritizing patient-centered care. Thank you very much for listening, and we hope you enjoyed this module.